1. Sensitive, sore, and heavy breasts. Tenderness or soreness in your breasts is often one of the very early pregnancy symptoms in many women. Changes to the breasts can begin as early as 1 to 2 weeks after conception takes place. While sore breasts can be a pain, but for those who have been actively trying to get pregnant, then this could be the earliest sign of pregnancy you have been waiting for. Pregnancy hormones are responsible for making the breasts sore and swollen, or they may also feel fuller or heavier to touch. Experiencing sore nipples and painful breasts are usually the first symptom of pregnancy. Many women start feeling these breast-related changes even as early as just 7 days after conception. According to the U.S. Department of Health and Human Services, breast pain can occur as early as 1 to 2 weeks after conception, which technically indicates weeks 3 and 4 of your pregnancy. You will feel the painful breast sensation at its peak during the first trimester as your body gets flooded with pregnancy hormones. These hormones are getting your body ready to grow your baby inside, and since your breasts are the primary source of food for the tiny human, these hormones work overtime to prepare your breasts for breastfeeding. Due to this, blood flow to that area increases, and your breasts grow larger. However, this growth is usually painful and can even cause skin itching and irritation. 2. Veiny breasts. Another of the earliest pregnancy signs related to your breasts is the appearance of veiny boobs. Veins are present throughout our bodies, and their primary function is to enable blood to be transported to the heart. While you cannot see them under your skin, but they are always there. Sometimes, veins become more visible through the skin in the breasts. This development is especially a noticeable condition during early pregnancy. A better way of describing this is that the veins that were already present in your breasts suddenly become more visible when pregnant. This phenomenon happens because there is an increase in your blood volume by nearly 20 to 40% when you become pregnant. When you are pregnant, your veins are responsible for transporting nutrients, blood, and oxygen to the developing fetus. Due to the increased volume of blood, the veins become more visible under your skin. The veins become less visible once you give birth, but it can continue to be present afterward, especially if you are breastfeeding. 3. Changes in your nipples. You may notice changes in your nipples as well. Your nipples tend to change significantly during the first few weeks of pregnancy. They may start to hurt, tingle, or may even protrude more than usual. Many women also notice that the areoles, which is the dark circle around your nipple, become larger and darker. A lot of women often notice tenderness in the nipples as the first sign of pregnancy, typically after 1 or 1.5 weeks before their periods were due. 4. Missed or late periods. According to the American Pregnancy Association, missing your monthly period or being late is one of the most well-known signs of pregnancy. 1 in 3 women finds that a late or missed period is their first pregnancy symptom. While there are many other symptoms that you may notice, but this is usually the big sign that prompts most women to take a pregnancy test. However, it is essential to note that a missed or delayed period is not a confirmed sign of being pregnant. Sometimes hormonal problems, weight changes, and recently stopping your contraception might also impact the timing of your periods, causing it to be delayed or missing a month altogether. For many women, delayed and irregular periods are quite normal, so it is useful to know about the other early pregnancy symptoms before missed periods. 5. Spotting or light bleeding. Many women experience light spotting or bleeding during the early weeks of pregnancy. It can occur in nearly 20% of all pregnancies and is typically associated with implantation bleeding. Implantation bleeding happens when the embryo or the fertilized egg attaches itself to your uterus's wall. The period when the embryo generally implants is between 6 to 12 days after conception. However, not all women experience spotting, so there's no need to worry if you don't get it. This action is in no way a reflection of whether the implantation has been successful. It is essential to understand that while in most cases, spotting is nothing to worry about, but sometimes it can be a sign of a more serious condition such as an ectopic pregnancy or a miscarriage. So if you experience any bleeding or spotting that is unusual for you, you should consult your doctor at the earliest. 6. Feeling queasy. One of the most well-known symptoms of pregnancy is morning sickness. However, while it is usually said that morning sickness can begin after 10 to 15 days of conception, some women may start to feel queasy as early as a week into your pregnancy due to several hormonal changes. Many women report feeling travel sick when they are in the car or on the bus. Of course, not every woman who is pregnant feels sick and throws up. However, it is estimated that around 9 in 10 women will suffer from nausea or vomiting, which tends to continue until 12 weeks or the first trimester. For women who are having a bad bout of morning sickness, it is recommended that they eat little meals spaced out throughout the day. Also, ensure that you increase your fluid intake. In extreme cases, your doctor will prescribe anti-nausea medication. 7. Period-like pain. Many women report experiencing this confusing symptom, especially just around the time when they would generally be expecting their periods to start. If you have been trying to get pregnant and begin feeling period-like cramps, and there is no sign of your periods, this could be an early sign of pregnancy. However, this is considered to be one of the less common symptoms of early pregnancy. For some women, this symptom can also be accompanied by spotting as a result of the embryo implanting into the uterus wall. 8. Bloating. One of the lesser symptoms of pregnancy is bloating. Bloating is usually due to the rising levels of progesterone. Progesterone is responsible for bloating as it allows the smooth muscles of the bowel walls to relax. Many women experience bad bloating during the first trimester, but not everyone experiences this early pregnancy symptom. 9. Stomach cramps. Stomach cramps can also be accompanied with spotting and are usually caused as the ligaments start to stretch out as the uterus begins to change shape. Many women report feeling sharp stomach pains within a week after ovulation. They also reported feeling tired and cramps at the time of their periods, and after a week, they started feeling nauseous. 10. Tummy twinges. This phrase might be a new term for many. However, those who experience this early pregnancy symptom are well aware of what tummy twinges mean. These are the curious feeling of pinching and pulling in the stomach that many women experience in early pregnancy. Tummy twinges feel like the muscles being pinched or stretched from the inside. You can also feel tummy twinges on either side of the stomach. Many women report feeling lower abdominal twinges, often on one side, but some also experience them on both sides. They occur due to the stretching and changing of everything inside to accommodate the developing fetus.